we are seeing that the ability of individuals who are infected through breakthrough infections, namely vaccinated people who ultimately get infected, that they are generally without symptoms or minimally symptomatic. However, it is clear that they are capable of transmitting the infection to uninfected individuals. And the data that they reported indicates that if you look at the level of virus in the nasopharynx of a person who's vaccinated and has a breakthrough infection, and compare that to the level of virus in the nasopharynx of an unvaccinated person who's infected, they're essentially equivalent, which would go along and underscore the fact that vaccinated people who do have a breakthrough infection are clearly capable of transmitting the infection to an uninfected person. I would hope that given what we've been through now and the number of months that have gone by since the EUA was initially authorized, I would hope that within the very reasonable period of time in the future, we'll see that. I hope as we get into the middle of August that we're almost there. But again, I can't predict because that's totally a regulatory decision. But one of the reasons of people not getting vaccinated, namely people who aren't strictly anti-vax, but they just are a little bit uncertain about whether they want to get vaccinated, that when there is full approval, several people, a certain percentage have said, when the vaccines get the full approval of the FDA, I would feel more comfortable in doing that. And what also will happen is that once you get full approval, local authorities will feel more comfortable in doing local mandates for vaccine. I don't see there being central mandate for the country of a vaccine. I don't see that at all happening. But I think what you'll be seeing is universities and colleges and some large employees or even small employees will say, if you want to work in this enterprise or in this institution, you'll have to show proof of vaccination. What I would like to see are the data that would validate the idea of giving someone a booster. Right now, if you look at the studies that are available, and probably we're going to get a lot more data from cohort studies that the CDC has been following. It's going up. How far up it goes is going to depend on how we as a society address it. The more people you get vaccinated, the less likely it's going to go up even more. Well, I certainly can't predict that because that's not within the lane that I operate in, but I can tell you it's under active consideration all the time. That's something that's always very actively considered about trying to get travel back. I don't know when that will happen, though.